The U.S. Department of Justice estimated that the rate of juvenile arrests increased by 30% from 2012 to 2020. Around half of the juveniles entering the justice system meet the criteria for a mental illness. As a result, the juvenile justice system has been increasingly strained to attempt to meet the needs of these youths. Many mental health disorders are linked to juvenile delinquent behavior, including depression, anxiety disorder, conduct disorder, and post-traumatic stress disorder. At least 10% of juvenile offenders will require extensive, long-term care. Other youth only require emergency or temporary care. Although, that number could be much higher. One study found that 27% of juvenile offenders have extreme mental disorders that hinder or prevent their ability to function in society. Several treatment methods have been proven to decrease the rate of reoffense and help reintegrate troubled youth back into society. CBT interventions focus on youth offenders suffering from affective disorders like depression and anxiety. Simply put, this treatment method combines various behavioral therapies to help youth transition skills they learned while incarcerated into the real world. In one study, this method decreased recidivism rates by about 13%. Multisystemic therapy focuses on family life, substance abuse problems, and other issues that cause emotional and behavioral problems. Recidivism rates have decreased by nearly 70% for youth participating in multisystemic therapy. Even with these promising treatment methods, the juvenile justice system is still struggling to meet community demands. Funding for social services fell following the financial crisis of 2008. The mental health care services offered by the system were no exception. Officials are still working to meet growing demands. As community-based services decrease, youth crime rates increase and the juvenile justice system is strained even further. Certain jurisdictions fail to adjust to the individual needs of juvenile offenders suffering from mental health disorders. The same treatment methods cannot be used across the board for all mental health disorders and behavioral problems. Screening methods and referral programs are insufficient. A number of youths do not receive services because their disorder went undetected. Some juvenile offenders are put in programs meant for adults. Juvenile offenders with mental disorders require unique treatments and therapies. Youth offenders being held pre-trial may be unable to receive adequate treatment, as only emergency mental health services are required to be available. Funding needs to be used more effectively. Diversion programs need improvements. Diversion programs divert a juvenile offender from the typical court process to community-based treatment. There needs to be a focus on improving mental health disorder screening and treatment referral procedures. Certain states already have successful programs and procedures in place. In time, these programs and procedures should be implemented on a national scale. Some jurisdictions have special courts focused on children with mental health issues. There are mental health courts available in California, Florida, Ohio, and a few other states. Ohio developed a promising diversion program called Ohio's Behavioral Health Juvenile Justice (BHJJ) initiative. The BHJJ is used to screen offenders under 18 years of age and send applicable offenders to community-based behavioral treatment centers. Several states, including Arizona, Colorado, and New Hampshire, have procedures in place to allow judges and lawyers to request screenings for juvenile offenders. In Virginia and Texas, the juvenile justice system is required to provide long-term assistance to juvenile offenders with extensive mental health difficulties, as well as substance abuse problems.